some bad news for airline passengers who perhaps enjoy having an alcoholic beverage or two before dozing off on long flights. A new study in the respiratory journal Thorax suggests that the combination of alcohol and cabin pressure may threaten the heart health of sleeping passengers. Dr. Narula joins us now to explain. This could be really bad news for a lot of folks, myself included. Again, before I take off sometimes, a cocktail, maybe two. What did this study find?
Right. A lot of people are about to get on flights today and might be reaching for that drink, but they may want to rethink that. So we know that physiologic changes happen when you fly. A normal oxygen saturation is about 96 to 99%. When you fly, that drops to 90%. But what researchers wanted to know is what happens if you combine flying with alcohol and sleep. So they took 18 to 40-year-old young, healthy adults and put them in a sleep lab. One sleep lab basically simulated altitude. One sleep lab was at sea level. It had them sleep for 2 nights, and before one of the nights, they gave them alcohol, about the equivalent of 2 beers or 2 glasses of wine, and they recorded parameters like oxygen saturation, heart rate, and sleep. And they found that those individuals who drank alcohol in the altitude simulated sleep lab had a lower oxygen saturation. It actually dropped to about 85%. The quality of their sleep, that kind of restorative REM sleep, was worse, and their heart rate increased a little bit. So may want you to rethink this. They do point out it was a small study, probably applies more to those in first or business class who have free, unrestricted access to alcohol, or also maybe sleeping more because they're laying flat, they're able to recline, but something to think about.
Were there age groups that were more susceptible?
So this was obviously a young, healthy population that had that oxygen saturation level fall, but the researchers say, look, I mean, we have to think about the elderly, those with underlying pulmonary disease like COPD or emphysema, cardiovascular disease, sleep apnea. They may not have as much reserve to kind of handle this lower oxygen level for a period of time. And so something for those who may fall into those buckets to think about maybe avoiding alcohol or drinking less or staying hydrated. None of us want to hear that emergency loudspeaker go off saying, is there a doctor on a plane?
No, especially you, since you're the doctor.
It has happened to me. It was not fun.
So is there anything like airlines should be doing?
Well, the researchers say that maybe airlines should be restricting or pulling back on serving alcohol. I'm not sure that is going to happen, but I do think that passengers can certainly be aware and take the necessary precautions if they fall into those categories that might be at higher risk. Although, I will say people have been drinking on airplanes for a long time.
Correct.
We do know that cardiovascular symptoms are responsible for about 7% of those in-flight emergencies, and 58% of diversions happen for cardiac arrest.
Wow.
So, it can happen.
Thank you, Dr.
Narula. Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.